All right, folks, so this is the ventilator that should be at every bedside in the cardiac and trauma parts of the resuscitation and critical care area. It's a Viasis Vela. It's an okay vent. It's not fantastic, but it does its job. Now, the first thing is when you come to the vent, there should be one of two situations. Either you'll see this tubing here, and these two viroguards, and these keep the patient's bacteria and viruses and tuberculosis from going into the ventilator. If you see that there's two of them, one on the exhalation port, one on the inhalation port, and there's a blue cap on your ventilator tubing, that is good, fresh, new tubing, and that is okay to use for a patient. If, on the other hand, you see a situation like this, with the viroguards missing, that means whoever set this up didn't know what they were doing, and you just throw away that tubing and you start fresh, because it means that these could be contaminated. If you come here and you see a situation where the viroguards are on, but this blue cap is missing, that means this was used on a patient, and you throw that whole thing away. You throw away the tubing and the two viroguards and you start fresh. So the only ways I ever want to see the ventilator are preferably blue cap and two viroguards, or if a patient just left the unit, nothing on the vent. If you see anything but that, you throw away what's ever on there, because you don't know if it's been used or contaminated. All right, so assuming we have that, the way these tubes are packaged is with these little ports open, and then the patient's not going to get any air. So first thing you always do is you check those and you make sure they're closed. All right. The on and off switch is on the upper right on the back of the vent. We're not going to be able to get the camera in there, but you'll be able to feel it. It's just an on and off switch. So you flick it up to turn it on. All right, you're going to have to zoom on in here. Now, there's only two modes I want you guys playing with if you really don't know what you're doing, and you probably don't know all that well your second year. If you have a patient who's intubated, then you're going to get this first screen, and the first thing you do is hit New Patient, and you're going to hit Accept. You can ignore this and just hit Setup Accept. And then you're going to hit this button in the upper left, where right now it says Volume AC. And if it was on anything else, you choose Volume AC. That's going to put them on an assist control mode, and it's going to put them on volume as their basis for determining the ventilatory cycle. And then this lower right-hand corner, you're going to hit Mode Accept. All right. Now, you put them on your initial vent settings. For most patients, that's going to be 16. And you do that by touching the actual number you want to change, using this dial here to actually change it, and then hitting Accept. Now, let's say we'll put them on a tidal volume of 480. We'll put them on a peak flow of 60, which is pretty much standard for all patients. We'll give them 5 a PEEP, and we'll give them 100% FiO2 initially. All right. At that point, you'll come on over here, take off your blue cap, and put that on the patient. All right. If the vent's alarming and you don't know why, the answer is not to push silence. The answer is to BVM them and find someone who knows what they're doing to play with the vent. All right. And ideally, you wouldn't be doing this at the beginning of your second year unless you know what you're doing. But there's something to you guys getting some familiarity. Anyone you put on a ventilator who's intubated, you have to call respiratory. You can put them on the vent first if you know what you're doing, but then you call respiratory. They have to see every patient who's been put on a ventilator. Now, the other situation you might be in is you want to do non-invasive, and we do non-invasive with these same vents. So again, you turn it on. New patient, patient accept, setup accept, upper left. And now what you want to choose is NPPV, which is non-invasive positive pressure ventilation, CPAP pressure support. All right, make sure you choose the NPPV one, because that will have leak tolerance for the patient in case there's a leak around their mask. So you choose that one and you hit Mode Accept. And then you only have 4 settings. FiO2, knock up to 100%. The patient's asthmatic or COPD, give them between 6 and 8 of PSV. All right, and for those patients, I'd put them on probably 2 of PEEP and leave the flow trigger alone. Now what that's actually doing is giving them 8 of pressure support and 2 of PEEP, because on this machine the pressure support, the inspiratory pressure, is additive to the expiratory pressure. So 6 and 2 is actually 8 and 2. All right? Let's say instead you had a patient with bad CHF or pneumonia. For those patients, I'd put them on a PEEP of 5 or 6 and then up that based on their pulse ox. All right? And they really don't need any pressure support. All right, so that's non-invasive. Let me show you where you get your masks. So the masks are down here, where it says BiPAP face mask. They get sized based on the package before you open them. So this is a size large, but you can figure out what they need because they have this sizing scale. So what you do is you put this scale on the patient's face, and it should fit just under the lower lip and around the nose, like that. I'm a medium. And you can try on all the mask sizes and see which one fits best before you rip one open.